models of it, including one here, including one in the big board right here. This is going to be used for three things. First, it is going to be used for identifying the tissue of the kidney. Second, it's going to be used for identifying the cavities in the kidney. Third, it is going to be used for the blood vessels going through the kidney. So we will go through each one of them separately. Okay? Now, if the label happen to be outside, anywhere here or back here, okay, that is the renal capsule. That is the renal capsule. Okay? Now, if the label happen to be all along right here underneath the capsule, but going all the way along like this, and the question said identify the layer. This is the renal cortex. You all see it? Renal cortex right here. Now, if the label happen to be after the cortex and going all the way around like this, covering more than one of those triangular structures, and the question said identify the layer, this is the renal medulla. Okay? So you have the renal capsule outside here, the renal cortex all along here with the question specifically saying identify the layer, and that is the renal cortex. The renal medulla is when the label is covering more than one pyramid like that, and the question said identify the layer. Even it is true that it is covering more than one pyramid and you wrote renal pyramids, that is wrong, because this is collectively known as the renal medulla. Now, if the label is only in one of those triangular things like this or like this, okay, the question is going to say identify the structure. And in this case, the correct answer is renal pyramid. Renal pyramid. If the label is in between the pyramids, like this or like this, where the yellow or the blue is, the question is also going to say identify the structure or the tissue. And these are called renal columns. Renal columns. So as far as the tissue of the kidney are concerned, you have the renal capsule, the renal cortex, the renal medulla, the renal pyramid, and the renal columns. Okay? You good? Okay. So now let us go into the cavities. At the very tip of every single pyramid, this area is called the renal papilla, and it's going to be labeled just like that. That is the very first cavity where urine collects as it is made in the nephrons. From the renal papilla, this very first, remember, you have to be very careful here at looking where the label is and what the name is going to be. The renal papillae are the tip, the exact tip of each renal pyramid. That is the renal papilla. The varus cavity right here after the renal papilla, that is the minor calyx. So this is a minor calyx, this is a minor calyx. I know that in some of your notebooks, this is labeled as the minor calyx. But that is not true. Okay? The minor calyx are the cavity right in front each renal papilla. When the minor calyx come together, this is called the major calyx. This is the major calyx. So a bunch of minor calyx will open together into a minor calyx like this, a major calyx like this. Okay? Now, all the major calyx will open up right here in this big cavity, right here called the renal pelvis, which is going to be basically labeled right here like that. That is the renal pelvis. That is the renal pelvis. Okay? Now, these are the cavities. Very simple. Starting from the renal papilla, going into the minor calyx, going into the major calyx, going into the renal pelvis. Then we have this structure right here, which is called the ureter. Which is called the ureter. Okay? Now, if you happen to have the label done right across like this, from here to here, and the question said, identify the area. This is called the hilum. That is the hilum. Okay? The hilum is the area where the blood vessels and the ureter come and go inside the kidney tissues. That is the hilum. Now, right behind it, here, this depression, the hilum I think is labeled in your lab manual, but this depression right behind it here is not labeled in your lab manual, and this depression right here is called the renal sinus. So in the back, it is the renal sinus. In the front, it is the renal hilum. The renal hilum. Okay? That is as far as the structures of the kidneys are concerned. Now, what is left for us is to talk about the blood vessels going through the kidney, and the good news is the arteries and the veins all has the same names. So if you follow, come on, stay right. Okay. If you follow, we are going to use a better model that shows these